Here I have got for MRI of the sinus by GP because the radiologist advised MRI of the pituitary and cavernous sinuses with contrast. So what we can see here, the GP or the general practitioner or a primary care physician actually needs to request MRI of the brain with contrast, including pituitary MRI. But unfortunately, the primary care physician or general practitioner or GP, what we call in the UK, has requested MRI of the sinuses. As a radiologist, it is easy to laugh at the request and reject it. But if I look from a primary care physician's point of view or a general practitioner, things look very different. There are so many sinuses in the body, starting from the skull to the ankle. There are plenty of sinuses. There is cortical venous sinus, there is cavernous sinus, there are paranasal sinuses, just to give example of brain and skull. So in a way, for a primary care physician, it is not clear that MRI sinus means MRI of the paranasal sinuses. So the GP has picked MRI of the sinuses, which the GP presumes the radiology department will do the MRI of the cavernous sinuses, not paranasal sinuses. Unfortunately, what happens in the NHS is these kind of requests are overlooked, or they bypass the vetting system because the radiologists are too busy and they do not have time for vetting, or they are not given time for vetting. The vetting is done by somebody else, by a junior MR radiographer, and these kind of things bypass the system, and MRI of the paranasal sinuses are performed in these kind of cases. So hence we need to be extremely careful. That vetting process needs to be robust, and instead of rejecting the form, we should be careful about what are the loopholes in the system, and we need to correct that MR sinus to MR of the pituitary and MRI of the cavernous sinus, that is MRI of the brain with contrast. So in summary, here I wanted to show the discrepancy in the clinical information and clinical request, and as a radiologist what we need to do.